So for an abdominal assessment, you want to start off with the patient's past medical history and their lifestyle, what they do for a living, how they live at home. You even want to know their diet since this is an abdominal assessment, and how if they drink or if they don't drink and things along those lines, because they can all have a key factor in what's causing abdominal pain or discomfort. Then you would move to inspection, and you would inspect the abdomen for contour, pulsations, lesions, hernias, distension. And for distension, you would want to consider the 6Fs because distension can mean multiple different things. So it could be flatulence, it could be fetuses, it could be fat or fibroids, um, or anything. And then after inspection, you want to auscultate, and you do that with your stethoscope. And you start off by auscultating the bowel sounds. And when it comes to bowel sounds, you want to work in a clockwise fashion. So you start with the lower right quadrant, and then you move to the upper right quadrant, and then to the upper left quadrant, and then to the lower left quadrant. And you want to hear bowel sounds in all the quadrants, but if you don't, you can't deem it absent unless you listen for 5 minutes. And an absent bowel sound could be indicative of a blockage or something like that, which could lead to something extremely serious. Then you want to auscultate for the abdominal aorta, which is right below the sternum in the center, and you want to listen to that. And then you want to listen to the renal arteries, which are to the sides of your abdomen on both sides, just like your kidneys are in the back on both sides. The renal arteries are on the front in both sides. And then with the bell of the stethoscope, you want to listen to the iliac arteries. And the iliac artery is located right below the belly button, and you need to listen with the bell of the stethoscope for that. And then after the iliac arteries, you would listen for the femoral artery back to the diaphragm of the stethoscope. And the femoral arteries are located on both sides of your groin. So next you would percuss. And when you're percussing, you're really just trying to figure out the size of the liver and the spleen. So when you percuss, you would start with the lower border of the liver, which is on the right side, and you would start on the lower side, which would cause you to hear tympani to dull. When you hit an organ, you should always hear dull. So you start off on the lower side, listening to tympani, and then once you've reached the organ of the liver, it should be dull. And you want to start in the right lower quadrant, mid-clavicular line, moving upwards. And when you percuss, you have 2 fingers on the organ, on your skin, and you tap with another finger over your fingers. So it's not direct contact with the skin when you're tapping. Then for the upper border, you would want to start on the right side of the chest area and listen for resonance to dullness. Because again, once you hit the organ, you'll hear dullness. And then the same thing for the spleen. You start mid-axillary on the upper side of the left side, and you percuss downward, where you will again hear resonance to dullness. After that, you'll move to the form of percussion called blunt percussion, and you would do blunt percussion of the liver and kidneys. So for the liver, you go back on the side of the liver, and where the liver is located, like mid-axillary almost, you would take one hand and you would cover the liver, and then you take your other hand and form a fist, and you would bang a little bit on the hand that's covering the liver. Not too soft, but not too light, and you want to note any tenderness or any pain. You would do this to the kidneys too, which are located posteriorly, bilaterally on either side, and you want to do it to both of them. So you would Same exact thing, cover with one hand, form a fist with the other, and blunt hit it, and no any pain, discomfort, tenderness, anything. So then you would move to palpation, which you always start off lightly because you don't want to cause more pain than what's necessary. So you palpate the abdomen lightly at first, note any pain or tenderness, and then you will move on to a deep palpation of the same spots, same abdomen, and note any pain or tenderness when you move deeply. Then you will palpate the liver. And what you'll do is you'll place, while the patient is still lying supine on their back, you'll place one hand, usually your left hand, since you're on the patient's right side. You'll place your left hand underneath the patient's back, underneath the liver, and then while the patient breathes in, you'll take the other hand and you'll kind of push down and in, and you'll know, and you shouldn't feel the liver. A normal liver you can't palpate. If you feel the liver, it's because it's enlarged and it might cause pain, and it could be indicative of something wrong with the liver. Then this is followed by hooking, and when you hook, you use both your hands, standing on the patient's right side because it still has to do with their liver. You take both your hands and you kind of hook down and around the bottom of the right rib cage with both your hands, and you kind of go in and up. And again, no pain or tenderness should be noted. Next would be Roving sign. So Roving sign is what's used for appendicitis, one of the tests used for appendicitis. And you would just look for rebound tenderness by palpating in a 90-degree angle, pushing straight down on the left side, noting for rebound tenderness on the right. You don't want to push on the right side because it could rupture the appendix. After Roving sign is Psoas sign, where the patient will lie on their left side and hyperextend their right leg, where you would note any abdominal discomfort or anything like that, which could be indicative of another appendicitis. After that is the obturator sign, and the obturator sign is while the patient lies supine, you would grab the knee and the ankle, and you rotate the leg in and out, noting any pain with that. And the last sign is Murphy's sign, and for Murphy's sign, the patient would lie supine again, and while the patient breathes in, you would just push in, down under the ribs, which is a little different from the original test of pushing down and in. This is just down, and there should be no pain noted.